Welcome back. So it's the dreaded cold and flu season, so let's play offense and not defense when it comes to staying healthy. Dr. Hailey from HCA Midwest Health is here with tips on keeping your family healthy. Now, we've got a lot to talk about today, including some kind of alarming flu statistics.
Yes.
You know, how is that impacting Kansas City?
This season is crazy. We're seeing dramatic spikes of the flu on both the Kansas and Missouri sides.
That's bad news for us.
It is.
Yeah.
You know, our 9 urgent care now clinics have recorded 1,200 cases of the flu since December 1st.
And is that a lot in comparison to like other years?
Well, yeah, that we've recorded 50% more flu and flu-like illness diagnoses in December of 2019 compared to December of 2018. And this doesn't include all the people that are going to our 11, ERs throughout the region. The CDC just released their weekly updated stats, and every week they're climbing. So now 15 million people are estimated to have had the flu.
Oh my gosh.
150,000 have been hospitalized and over 8,000 have died, and that includes 54 pediatric deaths. So the key to remember is this is not benign. It can kill, and even healthy people can get the flu.
Yeah, and that's something to really take into perspective. And even if it isn't that dramatic of a case, like something that's more symptomatic that we see around here, nobody likes waking up with those aches and that fever and something like that.
Absolutely, and it's all about protecting other people, not just ourselves. Healthy people can usually do well, but it's the people at extreme ages, our young ones, our older ones, our pregnant women. So those are also the people we want to protect.
Okay, now big question here. I got my flu shot, but maybe for someone who has not gotten it, is it too late to get it, and how can we go about that?
Absolutely not. Getting the flu shot for everyone in the family can greatly reduce your risk of getting the flu and lessen the impact if you do get the flu. We recommend that children 6 months of age and older, and those in high...
Even the little ones.
Even the little ones. Even those in high-risk medical groups, including like those over the age of 65, pregnant women, people with chronic medical diseases like heart disease, kidney disease, asthma, and diabetes get the flu shot.
Okay, and then what are some of the symptoms we should look for? Then bridging on to that, if we're seeing kind of advanced signs of this, when should we call the doctor or go to the ER?
Great question. So one of the biggest things I hear over and over is that it feels like they've been hit by a Mack truck. It's extreme fatigue and body aches, but you can also have, the cough, the congestion, the runny nose, headache, sore throat, the body aches, chills, and fatigue.
Okay, and then on prevention, we've already talked about the flu shot, of course, very important, want to encourage people to do that, but what are some other prevention methods we could take?
I can't talk about this or emphasize it enough. Sanitize everything, your hands, doorknobs, cell phones, other computer devices, the grocery cart handrails, any place where the flu virus or other respiratory viruses can survive up to 3 days. And
3 days? We better have those wipes ready.
Wipe everything. And common sense, cover your cough with your arm or your sleeve, whether you're at home or in public. Teach your kids to wash your hands. You wash your hands, and stay home. Keep your kids at home. Don't go to work. Don't expose others because this is rapidly spreading.
Right, I hear you there. Now, what do we need to know about the deadly coronavirus? Because we just saw this on the news after the Grammys last night here in KCTV5.
Yes.
What do we need to know?
So, we are monitoring this every hour with HCA Health Midwest, and especially with the 5th case of this deadly novel coronavirus being identified in the U.S. already. We know that the numbers are rising in China where it's originated. 2,700 people have been infected. Their death toll has risen to 80. We are still learning a lot about this coronavirus. The coronavirus is actually a family of many viruses, and some
that is not what we want to hear.
Well, and some are as mild as the common cold, but some are as severe as the SARS outbreak that happened in 2003. So we're watching, we're learning. Symptoms can vary. Some people can have as little or no symptoms. You can have the common cold symptoms with a runny nose, headache, sore throat. But the key features we're looking for are shortness of breath, fever, and cough. Again, there's no vaccine available. It's supportive care, and really, it's common sense right now. The flu is more prevalent right now in the U.S. But the same precautions are what we're using to prevent spread. You know, if you're traveling for the Super Bowl, just be aware. You know, look for signs and symptoms, and wash your hands. Use that hand sanitizer.
Keep the sanitizing wipes
everywhere.
there.
Yes.
Dr. Rachel Hailey, thank you so much for all of those tips. Now, for more information, you can actually head on over to hcamidwest.com.